Good day, Joyce and classmates. My name is Janet Healy, and today Group 2 is going to discuss the mental health issues of the penal population. The Group 2 members are the following: Caitlin Marie Chong, Nelly Andal Rosario, Christine Ditching, Venus Flojo, and myself, Janet Healy. So let's discuss mental health. What is mental health? Mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contribution to her or his community. Who belongs to the penal population? All penitentiary inmates and prisoners that are incarcerated for committing illegal acts are the population of the penal system. The punishment for the individual who committed crimes is confinement and incarceration. The downside of incarceration affects the penal population's mental health. It is a physically challenged place that makes them vulnerable. The identified contributors that lead to the development of mental health issues are the following: overcrowding, violence, conditions of confinement such as segregation, conversely, the lack of privacy, the lack of meaningful activity, isolation, insecurity about work, relationships, and others, and the inadequate mental health services in prison. According to SAPERS 2011, mental health problems are 2 to 3 times more prevalent in federal penitentiaries than in the general population. Proportion of federal offenders with significant identified mental health needs has more than doubled between 1997 to 2008. 71% increase in offenders diagnosed with mental disorders. 80% increase in number of inmates on prescribed medication. Based on the data gathered during admission from 2007 to 2008, 11% of male offenders had a significant mental health diagnosis. Over 20% were taking prescribed medication. Just over 6% were receiving outpatient services. Women offenders are twice as likely to have mental health diagnosis at admission. Over 30% had previous history of psychiatric hospitalization. Thank you, and the next slides will be discussed by Vin.
Hi, I'm Venus Flojo, and I am reporting about the incidence of mental health issues among the penal population. Offenders with a diagnosed mental disorder are typically afflicted by more than one disorder, which is often substance abuse. Incidents of serious self-harming behavior in federal prisons are rising. 1 in 4 women offenders has a history of self-harm, which includes head banging, slashing, or self-mutilation. On average, 11 to 13 federal inmates commit suicide annually. The Correctional Service in Canada, which is the CSC, states that mentally ill inmates represent a considerable proportion of prisoners who commit suicide, and their suicides are probably the easiest to prevent. So, common mental health issues of the penal population. The data collected were from 2015 and were based on the male sex. Alcohol and substance use disorder represents 49.6%, and they present when the recurrent use of alcohol or drugs causes clinically and functionally significant impairment, such as health problems, disability, and failure to meet major responsibilities. On the other hand, antisocial disorder, which represents 44.1% of the penal population, they disregard social rules and obligations. They are irritable, aggressive, act impulsively, and they lack guilt. They also fail to learn from experience. Anxiety disorder represents 29.5%, and they respond with fear to situations with signs of panic, such as sweating and rapid heartbeat.
My name is Nelly. Mood disorders is one of the common mental health issues of the penal population. So, this disorder is also called as the affective disorder. A person with this disorder has a persistent change of feelings from extreme happiness to extreme sadness. Uh, Two of the common types are depression and bipolar. Another mental health issue is the borderline personality disorder. A person with this personality disorder has lacking sense of self. They're emotionally unstable. They're violent to criticism. This personality disorder is between the neurotic or anxiety disorder and the psychotic disorder. Results from child sexual abuse. So it is more common to women because women are more likely suffer from sexual abuse. Pathological gambling. Pathological gamblers believe and consider that money is the reason to and the solution to all of their problems. They tend to lavish or to be generous to the point of being extravagant or manic. Another one is the primary psychotic. A person with this disorder has distorted awareness and thinking. One of the examples of this disorder is schizophrenia, in which having the symptoms of delusions and hallucinations. How do nurses apply the nursing process to identify mental health issues? Okay, number one is assessment. So through assessment, we observe our client. So we observe the physical appearance, the behavior, the communication patterns, and their facial expressions. So next is through interview. So it includes the patient's subjective experiences and health expectations. Number three is history taking. So when taking history, we ask the family history, the previous admissions, the previous treatments, if there is any history of suicide or abuse. And then the physical assessment. So by doing that, we assess the appearance of the client. So we assess the hygiene, the mode of dressing, their gait, the posture, the eye contact, if there is any injury, their gestures, and also their mannerisms. The mental status assessment. So we have to assess the cognition of the patient and also the orientation to time, to place, and to a person. Diagnosis through identifying human responses to actual or potential health problems, cause of problems, and signs and symptoms observed during the assessment, which includes the client and others' report, and also the nurse's observation and their learnings during the assessment. Planning. Prioritize the problems based on client safety needs, involvement of loved ones, agency status, resources, and legislative requirements. Nurses should validate also with client, family, and care team about the identified problems. And also have to establish expected outcomes, including the long term and the short term goals.
In continuation to planning, nurses must decide proper interventions, including transition and discharge planning, and establish criteria by which to evaluate psychiatric nursing interventions. Lastly, develop a plan of care in collaboration with client and the healthcare team that depicts on knowledge, experience, critical thinking skills, and client behavior. The next part of the nursing process will be discussed by Christine.
Hi there, my name is Christine Marie Ditching, and I will be discussing about the implementation and evaluation on how do nurses apply the nursing process to identify mental health issues in the penal population. As for the implementation, The organized plan of care is carried out within the perspective of a therapeutic relationship and in a therapeutic environment. So it is important for us to establish that relationship and environment so we can gain our client's trust. And this will also help us in achieving our goals for our client efficiently and effectively. Second would be provide necessary resources and physical, psychological safety and comfort. So for physical, providing a safe environment means free from harmful objects and stimulus. And for the psychological safety and comfort, example would be like building trust. And third one is identifying barriers to implementation, such as language barriers, sense of comfort coming from the client, whether he or she is comfortable working with you or not. And then family members and significant others could also be a barrier to implementation. Fourth would be constant observation of the interventions and change according to individual needs and stages of illness, anticipating and intervening to prevent complications, and then provide for systematic reporting and documentation. So the nursing process is a cycle. So constant observation of interventions and making changes when necessary is essential and is fine. So this also means that we are focused on our clients based on their needs and situation. And of course, anticipating their needs is important, as well as systematic reporting and documentation is very essential in the nursing process. And next would be communicate plan to others, arrange referrals when necessary, and delegate responsibilities for implementation. So when you communicate your plan to others, that means you are collaborating, and when you're collaborating, it leads to ease in arranging referrals and delegation of responsibilities for implementation. And now for the evaluation, first would be gather and scrutinize data to evaluate the outcome of interventions and the process used to implement them. Next would be validate the data collection with the client and family. Third would be determine the client's response to psychiatric nursing actions. So it is always important to validate data or information gathered, as this will also affect our nursing process, right? And assessing our client's response to psychiatric nursing actions will also help you plan effectively. Fourth would be evaluate anticipated and unanticipated effect of the client's response, measure the client's progress towards achieving goals and the quality of nursing care provided, evaluate the importance and effectiveness of the care and interventions given, compare the results with outcome criteria, provide further assessment, revise and correct psychiatric nursing diagnostic impressions, revise goals, expected outcomes, and psychiatric nursing interventions, and modify and document changes to psychiatric nursing care plan as specified, and lastly, keep an ongoing evaluation of the plan. Again, as I have already mentioned, nursing process is a continuous cycle until the desired outcome is achieved. If our initial evaluation is not met, then we go back and verifying our data or reviewing our diagnosis, changing our plans and interventions, and try other means of implementation, whatever that works for the client, and then reevaluate again. In this manner, we are not only delivering a client-centered care, but we are also ensuring that our goals for the clients are met.
My name is Caitlin Chong, and I will be discussing the last portion of our report. I hope you guys are still listening because this is an important part of our nursing practice. So what are the nursing responsibilities when caring for the penal population? Nurses play a key role in providing care to offenders serving time in Canada's prison. The Correctional Service Canada employs more than 700 nurses, and many of them go to work in one of Canada's 53 federal penitentiaries. Correctional nursing is unique. While nurses remain focused on providing the best possible care to offenders, they face numerous challenges in having to do it in a secure setting. The listed responsibilities below are from the WHO, Manitoba Health, and also from the Society for Education and Research in Psychiatric Mental Health Nursing. Let's begin. Provide inmates and their families the information, support, counseling, and resources related to life transitions, self-esteem, assertiveness, decision-making, communication, relationships, coping, and stress management. Identify, counsel, and/or refer for depression and suicide risk. Assess, counsel, and/or refer for weight preoccupation, obesity, body image, and eating disorders. Use of therapeutic communication skills that involve empathy, active listening, observing, truthfulness, and curiosity. Recognize the age, culture, class, ethnicity, language, stigma, and social exclusion on the therapeutic process and apply the care that is responsive to these determinants. Support and refer those with chronic illness to appropriate resources. Nurses have a responsibility to the public. Be advocates even for the penal population and promote the adoption and mental health legislation that protects human rights. People with severe mental disorders are sometimes inappropriately locked up in prisons simply because of the lack of mental health services. Provide inmates with access to appropriate mental health treatment and care. Divert people with mental disorders towards the mental health system. Ensure that the needs of prisoners are included in national mental health policies and plans. Effective management of rapidly changing situations, such as risk factors for self-harm, aggressive behaviors, and rapidly changing mental and physical health states. Provide access to acute mental health care in psychiatric wards of general hospitals. Ensure the availability of psychosocial support and rationally prescribed psychotropic medications. And lastly, encourage interprofessional and intersectoral collaboration. Collaborate with clients and the healthcare team to come up with a complete and client-centered plan of action. And that is the end of our report. If you have any questions, please direct them to the messages area or discussion board muddiest area. And our references are the following. Once again, thank you so much for listening, and may you have a good day.